Hi, everyone. Some of your names I recognize. I'm sure I probably saw you at the INSAW conference in February. I am Angela Gerberding. I work with Alex and Levon here at ICCB. And because we all wear multiple hats, one of the hats that I wear is I oversee ICAPS working with adult education. And so Alex asked me if I would be willing to talk about what ICAPS are, how can you all work with them, what are some options. So that's what we're going to be talking about today. I know some programs, I don't know if it's you or others, are already working with their adult ed program on their campus to do ICAPS work. So if you are welcome to, I may pick your brains and have you share kind of what you're doing and what that looks like. But if you're not, you're also welcome to ask questions. And as Brittany said, if you want to come off mic and ask questions, you want to throw things in the chat, that's fine. I'm going to have Brittany monitoring the chat because since I'm screen sharing, I'm not that multi-talented to be able to do everything all at one time. And so there you go. So we'll just go ahead and get started. What are ICAPS and how do they work in the non-credit space? See, I'm already struggling to get my slides move forward. What is the difference between IET and ICAPS? So I'll just jump into it. IET stands for Integrated Education and Training. You will hear these two words used interchangeably. They really do mean the same thing. IET is a federal name. It is required in the Illinois state plan, which implements the Perkins 5 law, which is where CTE is funded. And I know you all are Perkins, not CTE. No, I said that wrong. I know you all are non-credit and not Perkins, but just for some background on where this came from. So really it came from the federal level in 2019. However, in Illinois, we use what we call ICAPS, which is Integrated Career and Academic Preparation System. And that is why we call it ICAPS, because that is way too big of a mouthful to say every time you want to. It is Illinois' version of an IET, which is why I said they are the same exact thing. ICAPS is modeled off of Washington State's IBEST model. We require a team teaching additional to what federal requires, and we're going to talk about those components. But we've been doing this work since 2012. So ICAPS was in Illinois in 2012. It didn't come in from the federal until 2019. So for a while, we referred to them as IET/ICAPS. That created a different level of confusion. Programs were telling me they weren't running an ICAPS, they were only running an IET. I could not convince them that they were running the same exact things, but they were convinced. And so we said, all right, we need to eliminate one of these. So we have gone back to their ICAPS. But you may still hear IET used from CTE staff, from different people across the state. But just know that they are exactly the same thing. They are the same. So what are the components of an ICAP? What's required? And there's 3 required pieces by federal law to be an ICAPS. One of those is adult ed services. That's typically in the form of a support course, or support class. The second piece is workplace skills. So think about those as employability skills. So your resume writing, your mock interviews, but they're also your teamwork and your collaboration and how do you talk to an employer? How do you request time off ahead of time? How do you call in sick? Can you call in sick? Is that allowable? Is it acceptable? All of those kind of generic, doesn't matter where you're working, skills that everyone needs to know about being employed. And then the third required piece is the workforce training piece. And that is typically on the job, could be apprenticeship, could be clinicals, could be CTE coursework. It just depends. Some of our ICAPS are in CNA. And so the students that are enrolled in that, they're taking the CNA coursework, which leads into clinicals. They're doing a support course with adult ed. And then the employability skills are covered in the 2 courses that they are part of. Because in the CNA course, they're going to talk about what are you allowed to do as a CNA? Can you be on your phone? Can you not? What requirements, what kind of uniform do you have to have? Those are all employability skills. But in your adult ed class, in the support class, that may be where they're writing a resume. So again, that employability skill can happen in both of those courses. So those are the 3 requirements from the federal level. The additional piece that Illinois adds is a team teaching, collaborative teaching. We've called it a variety of things. component. And that is not because people at ICCB sit around and go, how can we make this more complicated for people? Collaborative teaching really is a best practice. It gives the students two teachers that they can hopefully connect with. It gives them two potential resources for jobs, for resume, for skill building. It gives them two people that are potentially checking in on them and tracking them and saying and talking to each other about, hey, Dalton wasn't in class this week. Do you know where he is? Yes, he told me where he was going to be this week. I told him he should tell you. Did he not reach out to you? His child had to have some sort of surgery. Here's what's going on. So it doubles the amount of support that the student gets, which is why it's a best practice. And so that's where those components fit, all within the ICAPS piece. A little bit more about the team teaching requirement. On the ICAPS side, when adult ed and ICAPS are typically housed on the adult ed side of the house. The place that non-credit fits into them is in this number 3, the workforce training piece. That's where you're going to find employers that need these classes. You're going to be providing maybe the coursework of it. Maybe some of the employability skills go in with it, but the adult ed program is the one that runs the adult ed support course. And so on the adult ed side, there's a 25% collaborative teaching overlap requirement, and that's on the adult ed teacher side. So that's not on the non-credit side. And this just means that the adult ed teacher, support course teacher, and the training course teacher need to work as a team at least 25% of their teaching requirements. Again, on the adult ed side. Because adult ed does not have the ability to make requirements for CTE staff or for non-credit staff, that's not a requirement on your side. It's on the adult ed side. But ways that collaboration, that team teaching can occur is in pre-planning. They can talk ahead of the class and say, hey, in our welding class, we know students always struggle with this math piece, and we teach it in week 6. So the adult ed instructor says, then we're going to start covering that math in week 2, 3, 4, and 5. So when you start in week 6, they go, oh, I've seen it. I know what we're talking about. It could be checking in on attendance and missing students. Like I said, when Dalton doesn't show up, where's Dalton at? What's going on? Have you heard from him? Nope, haven't heard from him. Have you? Oh yeah, this is what I know. Sharing curriculum. And by sharing curriculum, we're not, one of the things that often happens with ICAPS is sometimes that workforce trained teacher believes that we are trying to push the adult ed instructor in to take over their course. That is not the intention behind this at all. It really is the content is the content, and that your side is the expert on that content. The adult ed is trying to help support that content and that curriculum. So sharing the curriculum just means sharing, like I said, with the week 6 in math. In week 2, we're going to be talking about this vocabulary that they're going to need help with. In week 8, they've got this big test that we need to make sure they're prepared for. So it's that curriculum information sharing. It's not the teaching of the lesson plans that they're taking over. But it could be some co-teaching in the same classroom. So maybe Brittany and I are both in a classroom. Brittany's teaching the CNA class. I'm doing the support class. And Brittany has done CNA for years. She knows it. She's got it. She's certified. She's good. But I'm watching the students all be really confused about what she's talking about. So as an adult ed instructor, I have the expertise in helping explain pieces and kind of bring pieces maybe down a level to help with better understanding. So I may be able to say, hey, Brittany, let me elaborate on that. Is this what you mean when you said this? And that helps the students in the classroom understand. So it could be co-teaching, but it's not a required piece. The team teaching is very different than the co-teaching, which is why we've actually started calling it collaborative teaching versus team teaching to remove that stigma, maybe. And it's not a bad stigma, comes with its own connotations. But support services for shared students. Again, when I talked about the 2 resources and the 2 teachers and the 2 check-ins, there's just more support that goes into it. Again, keep in mind with this pairing, The training instructor is the expert in the training content. The adult ed instructor is the expert in the adult ed content. So with adult ed, they are typically working on, students are typically working on earning their high school diploma along with their welding or their CNA or whatever that coursework is. Or they might be English language learners that are working on bringing their English level up to where it needs to be to get into the job. I know on the ESL side of things, there are lots of students that come to this country that have medical backgrounds from their home country. They've been doctors, nurses, I mean, some of their medical experience would blow your mind. But they're starting over because those medical degrees do not transfer and they're not allowed to be a straight doctor here in the US. So they may be starting over, they may be changing fields slightly. So they may have, like, say in phlebotomy, they may know all of the skills. They may be able to do all of those things very, very well, and they know all of the vocabulary. They just don't know it in English. So they're working on bringing their English skills up and their communication skills and their pronunciation and their writing because they have the content, but they have it in French or in Arabic or in Chinese, which doesn't help entirely here. It could be beneficial, but they got to have it in English too. So that's where that adult ed instructor has that expertise in how to get them that help, while the content teacher on the workforce side is really the expert on the training piece. I feel like I covered a lot. Is there anything in questions in the chat? Do we have any questions at this point so far? Okay, I'm going to go with no.
Yeah, I'm not seeing any in the chat, but yeah, if you all have questions, please feel free. You can throw those in there. And then when there's a moment, I'm happy to share those with Angela.
Okay. All right. So in ICAPS, we have two different models, or what we call two different models. They're Model 1 and a Model 2. Model 1, student earns college credit. They earn an industry credential, and they're often connected to a community college because of the college credit they're earning. Model 2 is an industry credential. They're often connected with a community-based organization, a regional office of education, or a high school program, or a community college. So the difference here, Model 1 has 3 bullets, Model 2 has 2 bullets. The bullet that's missing in Model 2 is, and it's not missing, it's not there on purpose. There is no college credit attached to Model 2. That's where your non-credit programs can fit into this. So if you're running phlebotomy, you're running welding, you're running HVAC, you're running CNA, you're running whatever employment, whatever your employers are telling you need, whatever credential earning training could be an ICAPS Model 2. It doesn't matter that you're at a college or not. All of you are. It's really a Model 2 because students are not earning that transferable college credit that goes along with perhaps a CNA or a welding class if it's on the credit side of the house. But I know I've talked to Alex and Levon, and some of you are running those non-credit pieces. And so it makes sense that you could do a Model 2 ICAPS with your adult ed program. Questions on that? All right. And some of you are probably wondering, okay, this is great, but how does this really fit into us? So, like I said, we've been doing ICAPS since 2012. So we have a lot of approved ICAPS across the state. And this is broken up by pathway. So architecture and construction, we've got 12. Business and management and administration, we've got 9. Education and training is 16. Education and training, some of those are early childhood, but some of those are paraprofessional. And I know paraprofessional at some institutions are on the credit side, some are on the non-credit side. So that's another one that might be applicable for you all. Entrepreneurship, that's come about in the last couple of years. Again, it's one that some lands on the credit side, some is on the non-credit side. Health science, and health science is huge. It is our biggest number, but that includes CNA and phlebotomy and community health worker and EMT, and we've got a couple of dental hygienists and I'm trying to think of what are the other health science, some medical coding falls into health science. So just some different ones there. Hospitality and tourism, some of that is culinary. Um, some of that is restaurant type of work. Information technology is another big one. IT, it's help desk, it's cybersecurity, it's a variety of different areas. Law and public safety, we only have one, but we have one, so it's on the list because we've got it and it counts. Manufacturing, another big one for the state of Illinois, is again, that's going to be where some of your welding fits, some of your CNC, ICAPS, some of your HVAC, I think fits into manufacturing. And then we have transportation, distribution, and logistics. So that could be automotive, that could be commercial truck driving. Some of that is forklift. Forklift might be in manufacturing. It depends on what the intent behind the forklift is at each institution. And my point of sharing this list is to show that depending on your area, I know each of you have different needs in your area. Some of you are very heavy in manufacturing. Some of you have nothing in manufacturing and you're very heavy on the TDL side. We all have healthcare needs. Most of us have education training needs. And so we know that depending on where you're located, what it is that you need. And so ICAPS is one of those that really can be very specific for your area, and you get to build it how you need it to look. So some of the workforce preparation activities we talked about, there's an adult ed piece, workforce preparation activities, mention some of these, utilizing resources, using information, working with others, understanding systems, transitioning skills, and other employability skills. These are just some of the high level ones that are called out within the law. But some of our students only know one way to, they only know to go to a job board, or they only looked at LinkedIn. They don't know that there's other ways of finding jobs. So what are some other resources that you can share? How do you use the information that you find? We talked about working with others. So how do you collaborate? How are you part of a team? So all of these are some of those workforce preparation pieces that fit into ICAPS in a variety of different ways. Workforce training, according to the law, can be done in several different ways. It can be occupational skills training. And again, this workforce training piece is where the non-credit can fit in. So think about, what are your employers asking you for? What do you already have going? What are maybe some ways that you could grow your non-credit? What are some opportunities? What are some things knocking at your door that you need to be able to answer? And is ICAPS an option for them? ICAPS is not going to be the solution for every problem that you've got. I'm not putting that out there at all. But maybe it's one tool in your toolkit that you can use. On the job training with apprenticeships, incumbent worker training. I know Alex and Levon have talked about how several of you are doing some incumbent worker training with your employers. So if your employers are looking for specific credentials, and some of those incumbent workers, maybe they don't need it to get the job, but they need it to be promoted. Or maybe they don't need the high school diploma to get the job, but they need it to be promoted. A lot of times in welding, a lot of employers say that I don't care if they have a high school diploma to be a welder. Great. But do they need it to be moved up to a manager? Do they need it to be moved up to a trainer? Probably yes. In which case, then you could work with your adult ed program to build the ICAPS for those students that don't have their high school diploma or those English language skills with those incumbent workers to move them up, which then frees up more space for employers to hire the basic level welder. Combined workforce training and related instruction. Not a whole lot of that happens. Private sector training. That's where non-credit comes in, is that private sector stuff. And I am not an expert in non-credit. I just know that I've heard a lot of those words thrown around with Alex and Lamont about private sector and private work, working with private employers. Skill upgrading and retraining. Again, some of those incumbent workers, or maybe you just have students that are coming and saying, hey, I need to improve these skills. How can I do that? Entrepreneurial training, going big right now. Transitional jobs, job readiness training in combinations with the activities above, adult ed. AEL is adult ed and literacy activities, including with these things concurrently and in combination with the ones above. And then customized training. I think you all have heard of customized training. I think there's a whole section on one of your reports maybe about customized training and what you're doing. So again, these are different places that this can fit into non-credit. Where does ICAPS lead? ICAPS can lead a variety of places. It could lead straight to employment. It could lead to additional post-secondary education, and it could lead to potentially more training. And it depends on the audience that I'm talking to, what their goal is. When I'm talking with adult ed programs specifically, often we're talking about additional post-secondary education because they'd like them to stay at the college and do more somehow. Whether it's on the non-credit side with you all, or it's in the CTE side, or it's on the accredited traditional side that's going into maybe some business or IT, depending on where those live. But you all are on the non-credit side, so you're not as worried about that. I know there's been a lot of conversations about transitioning non-credit to credit and how do you get those students to do that. So that might be an option. But you're also maybe looking for employment, or you're just looking for that training that an employer is coming to you saying, oh my gosh, I really need this group of employees to get this credential and have this training so my company can keep rolling with what we've got. Part of that is because maybe they can't find people off the street that can do the job, but they've already invested in these employees, like an incumbent worker. Maybe we move them along the line. And so that's kind of where that works. So why should you all offer an ICAPS? What does that look like? So it can increase your enrollment. And I know enrollment numbers are up and down. I know ICCB has released enrollment numbers for, I believe, FY25 recently. I'm not sure where non-credit fit into that. But it can also just simply serve as a pipeline for future students. If they're already on your campus in the adult ed program, they already know where you are. They may just not know which building you're in or who to come find. So if you're working with your adult ed students or your adult ed program, set up a tour, set up a meet and greet, set up an opportunity for you to come in and talk to their students. It's fine. Typically, they're happy to have that because it creates a pipeline for their students at this point moving on, but it also, with you're over here, creates additional potential recruiting that you already have them. They're already a captive audience. You can grab them and keep them at the campus where they're already at. Increase tuition and fees. If you have more students, you make more money. You're able to meet employer needs. And that's, I've hit on that some with the incumbent workers or maybe new employees that need some training. You aid students in gaining the education and employment that they need because they're working on both sides of that at the same time. It expands exposure to your program. So I know in adult ed, one of the best marketing tools they have is word of mouth from students. I'm not sure if is true also on the non-credit side, but if students know you're there, they may be more likely to use your services. And if staff know you exist on the adult ed side or any other place on campus, they're more likely to refer students to you because they know you exist and you're there. So it's just expanding that exposure and who knows you're around. And provides opportunity for internal collaboration. At the NSAW conference, I did a session that several of you, I think several of you were at. How do you build those internal partnerships? How do you sustain those partnerships? Who's missing? Who else do you need to talk to? This was one of those that I talked about, was using your adult ed staff that's already on your campus. They're already there. How can you work together to help them, help you, help the students? It's a team effort. And so that's how that moves on. So we've covered a lot of information. Are there questions that you have? Don't worry, we're not done. I'm kind of wrapping up slides, but I want to hear from you. Are any of you working with ICAPS right now? And what types of ICAPS? What does that look like? I want you all to be able to share with each other, because I can talk about it from the ICCB side, but sometimes it's better hearing from your peers doing it what their options are, maybe what struggles they had, what successes they've had, and how does that work? So, and I will call on people if I see names. So, who's doing one? Who's willing to come off of mic? Okay, Bonnie's willing to share in the chat. I'm good with that. Hey, Alex, how's it going? Okay. We're working with ICAPS, just jumped on me. Under the IBT grant for CDL programs for adult ed students, ESL are currently on hold due to visa challenges. Yes, that is a problem across the state. Yeah, ESL and their whether it's visa, documentation, whatever it is you're looking at. Yes, those are currently some issues with ESL students. But keep in mind ESL, and I know a lot of times I've heard in the past that ESL students, programs don't know if ESL students can do the work. I have 20 years in ESL. I promise you, they can do the work. They will show up. They will do the work. They will exceed the work, and they will amaze you with the skills that they are able to present. So don't leave that group out because you're not sure if they can. I promise you they can. But I also know right now there's a lot of issues going on around ESL students. So I get that.
I want to clarify that that's only around the CDL
Okay.
area. We're still serving ESL students, but we're not actively recruiting them due to the challenges that we're having with visa status and the Secretary of State's office from
Got
the
it.
federal level.
Okay. So are you doing any other ICAPS other than CDL, Bonnie?
Under my umbrella, no, but
Okay.
they have certified nursing assistant, and I believe there's an automotive one as well that's not running and welding.
Yep. That all sounds right.
I think, but
Yep.
that doesn't all fall under my umbrella, so I'm
No,
not.
that's right. I get it. So did this come about only because of the IBT grant, or were you already doing it and you're now using the IBT grant to help fund some of it?
We've been talking about trying to partner with adult ed on several programs, but the IBT grant is what spurred the conversation because of the funding opportunity for it.
Okay, that makes sense. And as I said, I wear multiple hats, and IBT grant is a different hat that I wear. So what is the next step if we want to start a program? I will come back to that, Kara. I'm just reading all the questions. McHenry County has worked with ICAPS with our phlebotomy program. Yes, phlebotomy is an ICAPS that is often run on the non-credit side because it doesn't have enough hours to be on the credit side. So we have multiple colleges across the state that are doing a phlebotomy ICAPS successfully, and with great completion numbers. So, Blackhawk, we have ICAPS patient care, IT, and are creating welding. Good. Good. So, Kara, what is the next step if we want to start a program? So I would start with figuring out you're going to need to talk to your adult ed program. But I would start with figuring out what industry recognized credential training are you already offering. I would not start with like building this thing from scratch. I would start with what are you already doing? So if you're already doing a phlebotomy program, Kara, can you tell me what college you're at? Just for my own reference, because I've got some ICAPS in my head, not all of them. If you already have a phlebotomy program that's running, then maybe College of Lake County. Okay. I know College of Lake County has several ICAPS that are already approved, but I believe most of those are probably on the credit side of the house. So they're going to be well versed in what an ICAPS is. What they may not be well versed in is how to do it with a Model 2 on a non-credit side. But again, because I wear that hat, you are welcome to reach out to me and say, can you help us figure this out? Because yes, I will. That's part of my job. I'm happy to do that. And I probably Tasha Shell, or, and I'm drawing a blank on the other woman's name. I can see her face. Nicole, could be two people at CLC that you could start with. But figure out what you already have going and how could you add them to it instead of creating something fresh. And that doesn't mean you can't do something fresh. I'm trying to help you. It's easier to figure out with something you've already got going than to try to figure it out while you're building it. And did it work and was it successful because it was new, or did it work and because it was successful because you added one piece? So talk with them, see what you have, and an industry recognized credential is a credential that's going to get them a job. So I have programs that sometimes reach out to me and say, hey, is first aid and CPR something that I can do an ICAPS with? And my answer is, if you can tell me what job they will get with those credentials, then we can have a conversation about if it's an ICAPS option. Most of the time, like CNA, phlebotomy, patient care tech, a lot of those, you're not going to get the job with the first aid CPR certified. I can be first aid CPR certified. In fact, I have been in the past. That doesn't mean you want me as your CNA or your dental hygienist or your EMT or your patient care tech or sticking you with a needle, because it's not going to be pretty. And so first aid CPR by itself is great to have, but it's not enough to be a full-blown ICAPS. So what is the credential that is going to get them the job? And so when you're talking to your employer and your employer is saying, we got plenty of CNAs, but I want to know, could some of them be moved into an EKG technician? There's EKG certifications. So the answer to that could be yes, and you could do an ICAPS with them. Now, like I said, in order for students to qualify as an ICAPS, they must have an adult ed piece. And in order to be adult ed, they have to qualify as an adult ed student. And that means they have to either be English language learning below a certain level, and the adult ed has the levels for all these, and again, work with them to figure out what these levels look like. And or they have to not have a high school diploma. If they do have a high school diploma, maybe it was from 20 years ago, and we all know students graduate with a high school diploma with C's in every one of their classes. They are not the stellar student that's making 100% in all of their classes. And so if they have a high school diploma, but are reading or have math below a 9th grade level, adult ed can test for that. They have the test to qualify for that. Then they could qualify to be served in an ICAPS class. The other nice thing with ICAPS is maybe you want to start a phlebotomy program. And Kara, I'm just going to pick on you right now because you started the conversation. So maybe Kara decides she wants to start a phlebotomy program. She's already got 10 students in this program, but 4 of them are telling her they don't have a high school diploma. And adult ed has 3 more students that want to be in phlebotomy. Well, those 3 students aren't going to make a class by themselves. Most colleges will not run a class with 3 students. But those 3 students, plus Kara's 4 students, plus her other, whatever I said, 6 students, can all be in one classroom. These are not separated out classes because they're taking the same exact training for phlebotomy that everyone else is. This is not a watered down version. This is not a stripped down version. This is not a slowed version. This is the same exact training course. They have the support course that they are required to be part of, required to attend. So the adult ed 3 plus Kara's 4, if they all qualify, those 7 would be required to go to the support course. The other 6 are not. They can. But again, when you were in college and an instructor said, hey, we have this extra class that's for extra help, you can go. I'm sure all of us jumped right on board and showed up for every one of those opportunities. And we are probably some of the better students in the class. And no, we did not. I did not go to every one of those opportunities that was presented. So that 7 could be that ICAPS course by itself. And it's blended because they're getting that same phlebotomy training. I mean, they're all in the same training course. They all are moving through. They're taking the same tests. They have to hit the same state test. They have to have the same clinical hours. They have to do the same number of sticks with a needle. And that's about as far as I can go in my phlebotomy knowledge. But they have to do all of these same pieces. So they are, I mean, while they are also adult ed students, they are non-credit phlebotomy taking students. The same way if they're in welding, they're a welding student. They're not a welding 0.5 student because they're adult ed. They just also happen to be getting support in adult ed. It's the same way that if a student has a disability and you're sending them to the disability center to help with a computer reader, or you're sending someone to the tutoring center to get tutoring on the math that they need. They're just getting additional help. They're still that same student. At the end of the course, they get the same certificate. Nowhere does the certificate say you are awarded the phlebotomy certificate and an adult ed student notification. It's not on there. They have the phlebotomy. When they go to apply for a job, they have a phlebotomy certificate. It's not a phlebotomy through adult ed. It's phlebotomy. So they are the same students. So that can help your adult ed program get some students into a course to have a full course. It could, maybe Kara's only got those 4 students. And the college is like, no, I'm not running a course with 4 students. Well, guess what? She just found 3 more. And now the course is going to make, because now she's got 7 students in that course. They do not have to be separated out. Some colleges, I know College of Lake County, because they are big and because they've been doing ICAPS for a while and they've got a pretty good handle, they do have some separate courses because they have enough that they are able to fill their own courses with 8 or 10 students. Great. But that is not the case at every college across the state. So if some of you that are at smaller colleges, I know Bonnie is at Lakeland, and that is smaller than College of Lake County, just size number. It just is. Do not feel like you have to have your own course for these adult ed students. They are in that training course. Just it is the same course. They're doing the same curriculum there, but that's again where that support course comes in as helpful to help make sure they're getting what they need. So next step, figure out what you have, figure out what you need, and then go find your adult ed program and find out what they've got. If any of you, I put my email on the slides, which will be on the slides, but I'm also going to put it in the chat if I can figure out how to get over there. If you are not sure who your adult ed person is on your campus, send me an email. I can tell you who they are. I can also tell you what ICAPS they already have approved. So if, again, in Kara's position, she's like, I want to do a phlebotomy ICAPS. I can tell you if College of Lake County has an ICAPS in phlebotomy already approved or not. Not this minute, I have to look at a list, but I can find that out and I can answer that question. And I can do that for all of you across the state. Kathy, I see, is from IECC. I've helped her build some ICAPS over the years. And so again, reach out. Other questions? Anybody else working with an ICAPS right now that you are willing to come off mic or type in the chat and share what you're doing, what that looks like? I know Alex said there were a couple that were doing it. I just don't remember who they were or in what areas. And again, because we have so many of those ICAPS, it is hard for me to keep that list in my head. I do have a list and I reference it probably 2 or 3 times a week when programs email me and ask me. Also, if you are thinking about it, but you're not sure what it could look like and you want to talk to someone who's already doing one, if you know, and I can talk to Alex and find out if Kara says, hey, I want to do phlebotomy, and somebody at Lincoln Land Community College says, hey, I'm already doing a phlebotomy, but you're not sure who that is, I can also connect you with those and I can share who else is doing phlebotomy and you can pick their brains about what does that look like and how do these pieces all fit together. So when you're thinking about what it could look like, typically students would be in class. I'm going to use this as an example. I don't know how many days a week phlebotomy meets, but let's say phlebotomy class is from 8 to noon on Tuesdays and Thursdays. You give them a little bit of a break for lunch, and then they're in a support course on Tuesday afternoon from 1 to 2:30 or 1 to 3, whatever you determine is the right amount of time for them to be in that support course. So they're there, they stick around, and then they do the support course. It is a separate course from the phlebotomy because, again, they're all in that phlebotomy class. They're all showing up there. It could be just a smaller portion of them that are going to that support course. So you do have 2 teachers. It is laid out that way. But again, it depends on the structure of your training course. Sometimes like CNA may be from 8 to 11, 4 days a week. So then you could do your support class following it on Monday and Wednesday or Monday and Thursday, and you can pick what days and what that structure looks like. So there is flexibility within ICAPS because we know every institution works a little differently, runs a little differently. Are you doing credit? Are you doing non-credit? Is it a 1 semester course? Is it a 2 semester course? It could stretch 2 semesters. We have some ICAPS that start in August and they finish them in May. That's okay, as long as it works for your system, it works for what you're doing, it makes sense to get the credentials in that amount of time, and the students are able to do it. We just know that sometimes holding on to students for a long period of time is hard to do. When we first started ICAPS, some of the ICAPS were for 2 years because they aligned with associate degrees. Students weren't completing, and we heard that over and over and over, which is why a lot of the ICAPS have gotten away from a full-blown 2-year associate's degree and are now working with those shorter certificates, credentials, 1 semester, 2 semester, because students are willing to stay that amount of time. It's hard to stay for 2 years. All right. I'm at 11:45. You all are very quiet. I don't know if that's normal for this group or not. Hopefully you have found this helpful. If you have questions, like I said, please feel free to reach out. You can reach out to me. You can reach out to Alex. Alex knows how to get a hold of me. He'll forward an email to me. It's fine. Otherwise, I am happy to give you 15 minutes back in your day, unless Alex wants to add anything or alter that.
I don't. Well, I just want to thank you, Angela, for coming on and sharing all your expertise with ICAPS here today. Once again, I think it's another great avenue for our non-credit programs to begin working within their institutions to start building these programs together. And like Angela said, if you guys have any questions, feel free to reach out to her, or if you have any questions as well, I'll be sure to connect you.